Early identification and intervention are crucial. Recognizing symptoms in children and providing support can prevent severe cases. Public awareness reduces stigma and encourages early help seeking. Early action makes a world of difference for both conditions. The intersection of AIDS and OCD reminds us that physical and mental health are deeply connected. Someone with HIV may face obsessive fears about transmission, while someone with OCD may be consumed by the fear of contracting HIV. Treating only the body or only the mind isn't enough. Integrated care, addressing both physical and mental health, is essential. Healthcare teams should look for signs of mental distress in patients with chronic illnesses. Mental health professionals must recognize how real-world health threats can fuel psychological disorders. True wellness means caring for the whole person. By understanding these complex connections, we can offer more compassionate, effective care. The goal is not just survival but a life of quality and balance. When we treat both body and mind, we help people truly thrive.